I think I speak for the whole committee in thanking all three of you for being here and for educating us and the American people about what you and, in your case, your child has experienced. Let me begin my questioning with Ms. Vasquez. And I know you have experience, obviously, not only with yourself, but you have interacted with many, many hundreds of people with long COVID. Is one of the frustrations that the medical community or others do not believe, in fact, what you are experiencing? Is that one of the problems that you're going through?
Yes, absolutely. I daily, it seems like, hear from patients who have been experiencing long COVID symptoms, symptoms that are clearly as a result of their infection with COVID, being dismissed by doctors as anxiety, as pandemic stress. It's, I think, quite alarming that even with the media attention that it has gotten and all of the grassroots advocacy that we've done to educate, providers and the community about long COVID, it is not enough. There really needs to be, I think, a stronger, louder government campaign around long COVID for public health, and as well as clinical education to providers, particularly primary care. I mean, you said yourself that primary care is overwhelmed. It's really, really difficult to assess a patient in 15 minutes and get them everything they need.
Let me jump to Ms. Beal and Ms. Helm, just to pick up where Ms. Vasquez left off. How has your, what kind of impact, what kind of effect have you had in terms of reaching out to the medical community? Have you found doctors understanding of the problem? Have you been able to get the help you need, Ms. Beal, for your symptoms? Are others in a similar place?
Thank you so much for your question, Senator. Early on in my long COVID journey, it was difficult to find a doctor that knew what long COVID was. And I even had a doctor tell me that she didn't believe that long COVID was real. So, and that's hard when you know you're sick and you know it's real, and you have a medical professional telling you that they don't believe it. It's hard to get anything out of a conversation like that. I've become more selective in which physicians I see. I ask every single one of them, have you heard of long COVID? Are you treating any other patients with long COVID? And I think in the last year, more of the providers are more aware of long COVID, so that's been very helpful.
Good. Okay, Ms. Helm, you've introduced us to something I think gets even less attention than the overall crisis of long COVID, and that is how it impacts young people. I guess you have, not by choice, become somewhat of an expert on COVID in young people. Can you tell us a little bit about what you have learned as to how many kids are experiencing long COVID, whether they're getting the kind of treatment that they need, how it impacts, a teenager's life? Speak into the mic there, please.
Just being on social media and connecting with all these different groups of parents, a lot of times you get to talk directly with other parents and hear their stories. And there's a lot of parents that are struggling to get treatment for their children. I mean, they're trying all kinds of different, medications, supplements, even hyperbaric chambers. I mean, they're doing anything to try and help their children feel better. And I think the biggest thing in relation to the question about the doctors I come across, the doctors I've been around are not dismissive. They just say, I don't know. I hear that a lot from doctors. I don't know, I don't know, I don't know. So what I do is, because I've got the information from the clinic and the study and stuff, I tell them what I know. I was at the gastroenterologist yesterday and I said, did you know COVID lives in your gut for months after infection? And she said, no, I didn't know that. And I said, well, tell everybody at your office. And then she looked at me and she said, yeah, well, she looked at me and she said, well, how do I do that test? I don't even know how to order that test to see if they have COVID in their stool. And so I think that's part of the problem is the doctors need the information so that they can help the patients. Because they just don't know that COVID is doing this to people, I don't think. They're shocked usually when I tell them the stuff that I've learned.
All right, I'm running out of time. My last question is, what good question did I not ask any of you? All right, then, Ms. Mack,
Yes, I think a question that I would have liked to have answered is why it's important to include patients in research and education for clinicians and providers. And I think we have been living this. We have been living with long COVID since the pandemic began, and patients have been living with, infection-associated chronic diseases for generations. We know this stuff backwards and forwards, not only because we live it, but so many of us have had to do our own research. I am heavily invested in PubMed and Google Scholar. I can read a paper. I send papers to my providers. We are experts from a lived experience, and because some of us are getting in there and doing the research ourselves. So that's why it's important to include us.
see that? I knew I would ask a brilliant question, and it was you. Senator Cassidy.
I defer to Senator Dr. Roger Marshall.
Well, thank you, Chairman and Ranking Member, again. And this is personal for me. One of my loved ones is one of those 16 million people that suffered from long COVID, incapacitated for some 2 years. People often ask me, well, what